Albano Clinic is who did my PRP 10 years ago, so I'm visiting them today. This is Dr. Albano asking me all of my deepest and darkest secrets to help diagnose my knee. All jokes aside, he's obviously taking this very seriously.
Well, you go back to what you've already had done. Dr. did the knee scopes. Without having the operative reports, you could have another meniscal tear and an osteochondral defect. So the cartilage covering the knee should be smooth, and you can have a pothole in there, so a chunk of cartilage taken out right in there. You could have just a generalized wearing down of the cartilage and arthritis in there. You can get swelling in the bone if it's bad enough. So those are all the possibilities. I just gave a lecture on this. Well, one is just what you've had done already. Two, partial meniscectomies. What my talk was meniscal tears and the surgery, the partial meniscectomies, and what that really does to your knees. If you get the surgery, what happens is you now have less of a shock absorber between the two bones. You are 6 times more likely to have arthritis in there and 3 times more likely to get a knee replacement down the road. The surgery, it's maybe not the best way to do this. There's another way to do this though that might help save the meniscus, and that is if we use your blood, maybe your fat, your bone marrow, all these things can help save the meniscus potentially and then avoid all of those bad outcomes.
So pretty much what Dr. Albano just said is I've been doing things wrong the whole time, and I should have started this sooner.
To figure out what's going on in your knee, we've already had the x-rays and they look pretty good, but you can only see bones on the x-rays. We can't see the cartilage. So next step is to get an MRI.
So I had my first appointment with the Albano Clinic yesterday here in Salt Lake City, Utah. And now I am on my way to get an MRI on my knee. With the MRI, we should be able to get some answers as far as what in the world is wrong with my knee.
2 hours later.
Just had the MRI done, and in a couple of days I should receive a call from the Albano Clinic after they got a chance to go over the MRI results and, you know, see what kind of mishap or mayhem or whatever you want to call it is going on with my knee. An MRI is actually a really weird and strange process if you actually think about it. Stay tuned for the MRI results.